Welcome everyone to another Zoom office hours presented by Sehart Acupuncture for Anxiety. And I am joined today with Dr. Hsinyi Huang, one of our acupuncturists at Sehart. Dr. Hsinyi has over 20 years of experience and has been helping our clients turn their lives around, address root causes. And today we are going to be open for questions. All right, and I will start off. I'm going to start off with a question that I have for myself. And um, my question is all about migraines. And I would like to hear from you, Dr. Hsinyi. How do people get migraines? Why do they happen from a Chinese medicine perspective? I'm going to ask you to unmute yourself too. Well, there we go.
Uh, you can hear me?
Yes, yes. Welcome, Dr. Hsinyi.
Okay. So in Chinese medicine perspective about the migraine, it's nothing, it's a disease. It's thinking about our whole body, some part imbalance. And then I actually want to kind of I want to share in Chinese medicine about migraine diagnosis. They have different type. So I will kind of describe about like a seven type to
Yes,
everybody, okay? Because
you.
each type, because I know you are the Western medicine doctor. So for the Western medicine the perspective, maybe you can talk more to our audience more. But
Yes.
in Chinese medicine part, I want to share the TCM like a diagnosis about like a seven pattern. And that's really interesting. And then our audience also can check themselves which which type of pattern they have. Because they have some a little bit different symptom inside to kind of distinguish it different situation. So the first one is called the liver yang racing. It's the Chinese medicine diagnosis professional name. They call the liver yang racing. And typical the symptom is we all know the migraine is kind of not tension headache, right? And
Yes.
usually happen just one side. And sometimes probably accompany some symptom like a aura
Yes.
or like a light, right? Okay, so the the liver yang racing is kind of same thing like a migraine, but the migraine is still we call the headache.
Yes.
The feeling, the pain is we call general, we say headache, but migraine is kind of one type of like a professional symptom or disease name. Okay, so the headache with like a dizziness, irritability, or like red eyes. And sometimes the patient may be accompanied with like a bitter mouth, bitter taste. They feel the mouth, eat whatever, anything, they feel have kind of flavor like a bitter.
Mm.
So that type is liver yang racing. And the second one we call the liver tree stagnation. So the main thing is headache, but like linked to stress or female they have PNS problem and they also have an emotional issue, like feeling upset or like feeling anxiety or depression. And the third one is like a liver fire blazing. Blazing is kind of the fire is a lot.
Yes.
Okay.
Yeah.
So mostly this headache kind of in intense headache, really painful. And then you can see the red face and the anger. The people probably feel really anger. The emotion anger compare liver yang racing irritability is more anger. Yeah.
Okay.
And also accompanying with kind of digestion, a little bit kind of constipation-ish.
Mm.
So you can see a little bit different. I'm talking about the first one. pattern liver yang raising compare the liver fire blazing. They already have different. So for like a TCM practitioner, acupuncture practitioner, they if they are really professional, they need to kind of distinguish these different two types for the assessment and for the different principle, and the treatment plan will be a little bit different.
I see. So you need to
Mhm.
understand the client and their specific symptoms and how they feel
Yes.
about their migraine. So I'm going to be your client and
Okay.
going to ask you to help me figure this out.
Okay. I
You
still
need-
have a different other type. Can I finish them?
yes,
Because
yes,
totally
let's
seven.
proceed.
I just talk about like three.
Okay, let's
So
complete.
when I talking describe loss pattern, you also can think about you what kind of pattern you may have. Yeah.
Okay, let's
So
hear.
the another one, the fourth is liver wing. Oh, so the liver wing, the headache is like the sudden onset and the possession pain and with the dizziness or sometimes like a aura. So I can tell this one is more general. The
Mm,
people come for the general migraine problem usually is this
general migraine.
general. Before I talk about like three types, it's more severe or more like acute,
Hmm.
and need to more be careful about like a migraine, like a red flag with the like a maybe like we need to suggest them to see primary doctor because
Yes,
sometimes it may be close to stroke or something happen,
right.
right?
I see. Yes.
Yeah. So the liver wing is more like a general population that had a migraine, especially in the woman when they
Yes.
come see us. So the symptom is mostly happen with them. Yeah.
Okay.
And then another one, qi and blood deficiency. So this type mostly is like a chronic dull headache. And I can tell this type of the people, they mostly struggling like a migraine for many years.
Yes.
So mostly they will also have accompanied with some symptom like they feel fatigue over their complexion, mostly like a pale complexion. And then the sixth is blood stasis. So the blood stasis, the pain, the headache, the pain will be like a fixed, stabbing headache. It's stay there
Yes.
and it doesn't move around. Yeah.
Mm.
So I feel this type mostly the patient because we know when the people had migraine, sometimes when they moving, the migraine still feeling hurt or pain. But if tension headache when they moving, sometimes they don't aware they have a headache. This is a little bit different migraine and the tension headache, how to like distinguish.
Okay.
So so mostly the blood stasis is like the the headache is fixed and stopping headache. And that means it's like it's it's always there. Even they are moving, they move around, they still feel the migraine is just stays one part, never go away.
Oh, so it's constant.
Constant,
No
yes.
relief.
No
Okay.
reason. It's constant. Yeah. So and have like a history of the trauma or long-term like a stagnation. And then the last one is friend damp obstruction. The headache feeling like a heavy head with the foggy mind and sometimes nauseous. And mostly maybe uh, um, during during the summer or humid weather
Yes.
that trigger it,
Mm.
trigger their migraine. So this is kind of general typical seven pattern uh, in like a TCM diagnosis about the migraine.
I
And
see.
of course, we also need to kind of combine the patient's our client the pause to see the pause feeling is deficiency or access to kind of diagnosis which part and with the tone.
Yes.
Uh, so any question?
Yeah, well, it's interesting that not, there's seven unique patterns
Yes,
that you need to understand the individual and see which one they may fall into so
yes,
that you can focus treatment and relief based on the individual. And
really.
when I think of migraines in a Western medicine sense,
Mm-hmm.
yes, people have different experiences, but we generally think of it as one problem.
Mm-hmm.
And classic migraine would be present with many people have an aura. And
Mm-hmm.
for those who don't, an aura is usually some kind of temporary visual deficit.
Yeah.
Example, classic is seeing electric lights,
Mm-hmm.
in both eyes. So it's not just one eye, it's the eyes together. And you see this electricity, which can it can prevent you from seeing
Mm-hmm.
clearly. So what we call a scotoma, which is a blind spot. So the
Mm-hmm.
flashing happens for most people 20 to 30 minutes,
Yeah.
about that time, and then it stops. And
Mm-hmm.
and then what in Western medicine we think of migraines as vasospasm. So
Mm-hmm.
the blood vessels in the brain
Yeah.
are spasming
That's
and not and this is what's causing the symptoms. And this is, very general. No one, I feel like we don't really have a good handle on migraines because we have our treatment options in Western medicine are so poor.
mm-hmm.
Um, and some people have triggers, sometimes it's food, sometimes it's weather, like you say, humid conditions.
Yeah.
But other people, it can happen randomly without anything, morning, evening. Um, and oftentimes, some people just have the aura and nothing else. Other
Mm-hmm.
people may have severe aching headache
Mm-hmm.
that can last 12,
Yeah.
18 hours. It's the whole day. And a lot of people experience nausea.
Mm-hmm.
So you feel sick kind of, and and there are various migraine drugs that you can take. And in my own limited experience and even discussing with medical colleagues, they're not great. They can help, but the real key for migraine treatment is prevention, I believe, because once it's happening, ibuprofen, putting ice on your head, laying down in a dark room, it just helps you get by as the episode is passing. So it can be very debilitating.
Mm-hmm.
There are some people who get migraines multiple times a week, and there are some people who get maybe once a year getting a
Mm-hmm.
migraine. It's so variable. We know that hormones can trigger it. Sometimes people going through different cycles, or maybe people who are pregnant may experience more frequent migraines. But it is an area that we don't have great solutions. And so, I know that we have clients who come and see you
Mm-hmm.
who have migraine issues. I'm wondering if you have any comments on how we can prevent migraines from happening, but also when they begin, do you have any recommendations for people who need to get some relief for the 24 hours of pain,
Yeah.
debilitation, that sort of thing?
Okay. So the first question, I think I would recommend like I talking about like a seven pattern, right? So
Yes.
according the seven pattern when you have for like a if simple home remedy, you can get this kind of balance from your diet. For
Mm,
example, like if you you just heard me like we talking about liver fire, like fire, or
yes.
liver fire blazing, they all fire. So that means when you have like a migraine itch, you need to avoid like hot or spicy or greasy food, you know, or which may like stay up the liver young and the fire. So you should eat something light.
I see.
The like a fruit, it can cooling your body system to get a balance. Because in your body is a lot of fire in your body. You don't want to intake more spicy food or greasy food to trigger it.
So you're saying liver yang being the high energy,
Yeah.
need to counteract that somehow.
So you need to kind of suppress it. And then this is even acupuncture, same thing. We use the technique to suppress, not tonify. And that's interesting. I read the because migraine is kind of neurology-ish,
Yes.
right? And you mentioned about the vessel. It's more when it's kind of relieving something, so cause it. So my mean is when we insert the needle, we stimulate, we should use technique to kind of suppress, to make the vessel it's not like a activity.
Oh, so the opposite
Opposite.
of
Yeah,
increasing
exactly. That's
circulation.
why
Okay.
I believe the acupuncture can help
Hmm.
because it's help to suppress your vessel muscle activity because your vessel activity in the brain will trigger migraine. Or when
Yes.
they have migraine, it's because the brain vessel is too activities.
So if you do when people have acupuncture, that tends
Mhm.
to move stagnant chi. So when
Mm-hmm.
you want to suppress overaction and over energy, how does the acupuncture work? How do you change the effect of the acupuncture?
Yeah, so acupuncture point actually is kind of a little bit kind of nervous system. They can suppress, but they also can activity.
I see.
So it depends on the practitioner, their how to their technique to twist. Yeah, you can follow the clock. Usually we have tonify technique and also another one is kind of suppress technique or element technique.
I see.
And also choose the point is also depend on the point. Some point is more tonify and nourish, but some point it's help to like decrease heat or clean heat. Their
I
specific function and direction is work on like a clean heat or like eliminate toxin in your body.
I see. So it's your technique,
Mm-hmm.
insertion, and the points themselves
Yeah,
that are designed to help create the effect of
yeah.
suppress.
Exactly. And
That's
that's why we need to learn this different seven pattern. The
yes,
different, yeah. It's not so, it's very interesting. This is not only, oh, this patient have migraine and everybody, the treatment protocol is all the same. Everybody should be a little bit individual.
absolutely. That
Yeah.
makes sense. I think part of the problem with Western approach is that we have the same drugs for everybody. There's no specialized, personalized
Mm-hmm.
assessment of what is out of balance.
Mm-hmm.
I know of people who have weekly acupuncture
Mm-hmm.
so that they do not ever experience migraines. And
Ah,
I want to hear about how does regular acupuncture help to prevent
mm-hmm.
migraines? Maybe you can talk about how think about if yes, it depends on which of the seven patterns is
Yeah.
fitting, but how does
Let,
prevention?
okay. I think a prevention, the first, you need to control your stress sometimes, the first things.
I
Yeah.
see.
And then another thing is like you need to have great sleeping quality.
Your sleep quality.
Yeah, if your sleep quality is good, sometimes can help you prevent the migraine happen so often. And it makes sense when you sleep good and then the other day you feel more energetic.
Yes,
It also help you distress. When you feel tired, you need to face your work, your routine life. You don't have energy. Yeah, of
right.
course, will make you stress more and cause you feel headache or trigger the migraine happen.
So
And
we have
mhm,
to work on stress and
stress and the
okay.
sleeping, they work together. And I can show like a general pain relief point. It's located on here. Maybe, yeah, it's the second finger, and we call this point the um this the middle of the bone. Yeah. And you just press it and just massage by yourself. You can feel a little bit aching and soreness.
Yes.
So this point is very useful any pain, whatever headache, migraine, toothache, stomach ache. Yeah. So I mean, prevent the this one is not only for pain relief, but in the same time can also general to help you tonify your body, like a chi
Yes.
for every day. You just gentle massage about 5 times, 5 times a set,
Yes.
like a 1, 2, 3, 4, 5, and then release. Yeah, and you just do 5 times 5, totally 25 times. And you switch to another hand. Yeah. And when you do this one, I always would kind of recommend client and you don't think of anything. You just focus on the your finger, stimulate the point. Yeah. To
That's
let it
great. Thank you.
relieve the like natural painkillers endorphin.
Yes. Yeah, that we can do ourselves, which is that's wonderful.
Yeah. And
So,
another point is on back of the head. Yeah, they call the 风池. Yeah, this one. But I think the point, yeah, the point on the hand is more easier.
yes.
Yeah. So the head is kind of around you behind your head, and you can just stimulate like this one, 1, 2, 3, 4, 5, and then relax. Yeah, I can do just 5 times.
That was very clear. So, so this back of head and in the between the thumb and the first finger on the bone
Head.
of the first finger, each
Um,
hand. So these can help reduce pain and they release natural endorphins.
yes.
This is very helpful. Good.
Oh, thank you.
Um, and you know, is there anything that people can do, when you have the aura? And I'm
Mhm.
asking you because, I know that there's nothing that we have in Western medicine. Once you know you're starting to get a migraine and you want to stop it or you want to, is it possible? Like once the process is happening and you have your aura, are there any Chinese medicine techniques that we can use to blunt it and prevent it from becoming a full-blown
Mm.
day of pain and debilitation?
Um, so like I just described the aura is happen and the pattern kind of liver wing in your body. Okay, have like a liver wing.
Liver
So
wing.
yeah, liver wing. The pattern called the liver wing. So think about the wing. Wing is like a wing is in your body
Yes.
will be like a moving, right? So you need to kind of calm your liver's like liver meridian.
Okay.
And then we should like take take off the wing from your body and then to help the aura, mm, the aura condition getting better, right?
I see.
Yeah. So I would recommend like people can there is one point called the liver 3. It's located on our foot, the first toe and the second toe, between the first toe and the second toe. Yeah.
Okay.
So they can do the gentle massage.
Like just with your finger push
Yeah.
deeply on
You
there.
can, at least you soothing the liver 3 point to help reduce the riverine nasal activities
Hmm.
to suppress. Yeah.
That's helpful too. So
Uh,
we have a few techniques to use for pain related to migraine, but other pain we may be experiencing.
yeah. And then I would recommend people can kind of take some the how to call the chrysanthemum tea, the tea is like a flower, or goji berry. Goji berry is a good one.
Goji
You
berries and chrysanthemum tea.
chrysanthemum tea, a special chrysanthemum tea is clean the heat in your body.
Ah, so maybe having chrysanthemum tea regularly will
Mhm.
keep all that heat and yang, keeping it down. Yes, good idea. Good idea. Um,
And I think also like the liver wind problem, the patient need to be careful aware their blood pressure.
mm,
Can they need to kind of also monitor their blood pressure because maybe their blood pressure sometimes will be a little bit higher than other people.
I see. Interesting. Well, this is very helpful. And can you recommend an acupuncture protocol for somebody who has migraines, whether they have frequent migraines or maybe not so often? What would you recommend in terms of, how often should people come? What to expect with an acupuncture protocol?
So I would say, especially for the acute migraine happen, I I believe and what I observe in the clinic, I see at least a 60% patient or 70% after treatment, the pain can relieve about like a 60%.
Acute, when you're having acute migraine.
Yeah, because the needle is kind of stimulate some point to help you relieve pain.
Yes,
But honestly, usually after one session, they feel better, right? But after 3 to 4 days, the pain maybe come back. It depends on the patient's body responding. Sometimes probably after the treatment, right away they feel the headache was gone, but in the other day, it's coming back.
I see. It may return. Okay.
Mhm. It
Um,
may return easier. So I would recommend like at least like a for for the acute like a migraine when the beginning at least like a 3 times a week for a month, and then to see how is it, and we start to reduce the like a treatment plan.
I see.
And but the chronic migraine, it should be take a little bit longer time. Yeah.
Yes.
And especially for the chronic migraine, the problem is not only headache, or the problem will be a lot of internal system imbalance. So need
Yes.
to address. So I would recommend the chronic migraine patient or client need to come more like a regular. You can do like a 4 times a week for a month to see the result. It's
Yes.
not only help your migraine reduce or headache reduce, but in the same time, it may help you feel your body more energetic, more balanced, and help you sleeping better. Remember, I said the sleeping is a very important key to help you maintain your migraine issue.
Yes. Yeah. No,
And,
clearly. Yes, this is good.
and in the same time, it help you to kind of stress manage.
Yeah. So acupuncture helps so many things. You're
Yes.
coming because you have the migraine, but at the same time, your body is being rebalanced. So other symptoms, other
Mhm.
organs are being improved because of this approach that looks at the whole body.
Yes.
Yeah, that's very important. I think in Western medicine, we don't think of migraines as related to other systems. And
Uh,
I think this approach where we have too much energy or too much wind, or other deficiencies, we can actually help everything in the body.
mhm.
So not only maybe fewer migraines or more mild, but other things can improve as well. This is really important, an important point. This is all the time. The main difference with the Western medicine approach and Chinese medicine approach is that in the Chinese medicine approach, everything can benefit.
Yes.
Western medicine approach, we're a little bit narrow in how
Mhm.
we address the problem. And so there's always a time that we have to be narrow, but if we can look more broadly, that's where we can get some benefit. So this is very helpful to learn about what we can do for migraines.
Thank you.